Hello, this is Ashley, and this is my presentation on the Tuskegee Study. What we have here is just a table of contents. This lists what's all going to be in the presentation, and some of the things we're going to be going over today in the presentation are the history and background regarding the study, what is syphilis, any ethical issues caused by the study, legal concerns, and new laws and regulations that were put in place because of the study, the impact of the study, and how healthcare professionals can avoid similar issues. And then we're going to end off with a summary and reference slide. This study began in 1932 and it lasted an astonishing 40 years, so all the way from 1932 to 1972. All the study subjects were African American men, and the purpose of the study was stated to be to observe the effects of untreated syphilis. Although all the men in the study were not even informed they had syphilis, and they didn't know the real reason behind the study. So some of you may be wondering why the men would even participate in a medical study. It's important to note that the men in this study were specifically targeted because of their lack of education levels, their race, and their location. Now, all the men in the study were poor sharecroppers from Macon County, Alabama. And they were also enticed into this study. They were promised free medical care, sometimes even with financial incentives, and this was something that otherwise that they would not be able to afford. Some other things to note are there was a total of 600 men all involved in the study, and 399 of them had syphilis and 201 did not. And the men were only told the study was going to last 6 months, and as previously mentioned, it spanned 40 years. So, what really happened in the study? The men were never treated for syphilis. They were told that they were getting treatments for bad blood. So, the treatments they were receiving were false, but the men believed the treatments were effective. And it is important to note that, again, the study was from 1932 all the way to 1972. But in 1947, penicillin was invented that could have treated their syphilis, but it was never made available to them. So what happened as a result of the men being untreated? Because remember, 399 of the men actually had syphilis, but they were never made aware of it. And it is an STD, so it is easily spread. 128 of the men died, and 40 of the wives ended up contracting syphilis, and 19 of the children were born with congenitive syphilis. These are just a couple of things that I was very surprised to learn when researching about this study. Again, the men in the study were never told that they had syphilis. They were never told about penicillin, which was the best treatment at the time. And penicillin is just an antibiotic, so the treatment would have been very easy for the men to obtain. The medical staff that was supposed to be treating them discouraged them from getting help anywhere else. They did not want these men to be receiving medical treatment anywhere else. And actually, as I was researching, I read that the medical staff that was involved in the study gave out a list of names to, the other local hospitals and doctors' offices to try to stop them from, letting these men know that they had syphilis. And the staff kind of enticed the men not to receive medical treatment elsewhere. They would, offer them financial incentives, and they would use the phrase it was their last chance to get free medical care. This is just something I wanted to include. Now, this is actually a picture of the letter that some of the men would receive. And if you note the last sentence here, it says, "Remember, this is your last chance for special free treatment. Be sure to meet the nurse." And this is just an example of how the researchers would entice these men and take advantage of them to get them to participate in this study that they weren't even aware was happening. So this is just some information on syphilis. I felt like it was important to include this because syphilis is an STD, and without treatment, it can cause some serious health problems. It can spread to the brain, the eye, the nervous systems, and the ears. And these are some of the more threatening issues it can cause. A confused mental state, muscle weakness, blindness, hearing loss, and dementia. And there are more than just what's listed. These are just some of the more serious threats. And if left untreated, it can also affect those who have it 10 to 30 years later and can cause infections in various organ systems, although this is rare, but it can still happen. And the cure is, quite simple. It's just antibiotics. So now we're going to be getting into some of the ethical concerns that were caused by this study. The men obviously had their privacy violated in numerous ways. Again, they were told the study was only going to last 6 months. It lasted 40 years. And their personal information was really not protected. It was shared without their knowledge in numerous ways. This is continuing on with ethical concerns, and this slide is going to cover informed consent. And informed consent is keeping the patient aware of all the benefits, risks, and alternatives, if any, of any medical treatment or procedure they will undergo. And the men in the study had their informed consent violated because, again, they were never even told that they had syphilis. They were told that they were being treated for bad blood. And because of not being told, is listed in the previous slide, the men were exposed to all the risk of untreated syphilis. And they were not made aware of penicillin because, again, they weren't even aware that they had syphilis. And they were receiving treatment, but they didn't know what it was. And some of the treatment they were receiving was actually dangerous to their health. This slide is still continuing on with ethical concerns. This one is regarding non-maleficence, which is an ethical principle that requires caregivers to avoid causing patients harm. And the men in the study were obviously harmed because they were not receiving any beneficial treatment or actual medicine for their issue, which was syphilis. And again, in some cases, the men received treatment that harmed them. An example of this is they were receiving spinal taps, which can be very dangerous, and the men were told it was a shot for their bad blood. And the medical staff actively encouraged the men to not receive medical treatment elsewhere, so they were causing them harm. And this will be the last slide regarding ethical concerns, and this is going to cover justice and distributed justice. And justice is the obligation to be fair in the distribution of benefits and risks. Distributive justice is a principle requiring that all persons be treated equally and fairly. And the men in the study were targeted because of their race and their social status and their lack of education, so they were not treated fairly based on these factors. And if the men were treated equal, if they had been treated equally, they would have received the medical care they were promised. They would have actually been informed that they had syphilis, but instead they were misled and they were lied to about their medical condition. Also, the treatment they received could have been harmful to their health. And because of these men being treated unfairly, some of their spouses contracted syphilis and some of their children were born with it. This slide is going to now cover some legal concerns that could be brought up, and a big issue in here is informed consent. So the law for informed consent was passed in 1905, and again, none of the men knew what was really happening. They were lied to, and they weren't even informed that they actually had syphilis. They were lied to about treatments. They were told they were being treated for bad blood. The men in the study also received treatment that could have been harmful to their health. There is also the issue of the families that were affected by this study because, as previously mentioned, 40 of the wives in the study contracted syphilis and 19 children were born with it. And the researchers in the study actively stopped the men from receiving treatment elsewhere. The men in this study were targeted because of their race, their lack of education, and their social economic standing. And again, the men were told the study would only last 6 months, yet it lasted over 40 years. Because of this study, there were new laws that were put in place to protect patients. There was also a memorial built to honor those affected by the study, and it also serves as a reminder to ensure nothing like this ever happens again. And the National Research Act was signed on July 12, 1974, and it created the National Commission for Protection of Human Rights of Biomedical and Behavioral Research. And this act was intended to protect human rights and protect human subjects, basically to protect any humans that were involved in medical research. And this act set guidelines on who could be selected for the medical research. It also created some much needed boundaries for medical research and required the participants to give their consent to be in the study. Continuing on from our last slide, some of these new regulations that were passed now required all researchers to get informed consent from any individuals that were going to be participating in any medical studies or research. Now, this regulation was applied to any individuals participating in any experiment that was held by the Department of Health, Education, and Welfare. Also, the studies had to be passed by a review board, and this review board was just to ensure that the ethical and moral standards of the study were upheld and that they did not cause any harm to anyone that would be participating. This slide is continuing on regarding new laws that were created. In 1995, the National Bioethics Advisory Commission was created by Bill Clinton, and this commission was created to ensure that the moral and ethical guidelines were followed and to protect the rights of any individuals who participated in medical research. In 1979, the Belmont Report was published, and it is now required that anyone who takes part in medical research reads it. And the Belmont Report covers three principles regarding human medical studies. One, the subjects taking part in the study must be respected and consent to the study, or they give their informed consent to the study. Two, all the subjects have to be informed of all the possible risks and possible benefits involved in the study. And three, the same treatment must be made available to all subjects in the study. And when selecting those for the study, it must not be based on their race, their gender, or their social economic status. So now I'm going to cover the impact of the study. And as mentioned in the previous slides, because of this study, there was new various laws, programs, and committees that were made and put in place to protect those involved in medical research. Although this study did have a lot of negative effects for the African American community, this study led to distrust in medical staff, in hospitals, for the African American community. And an example of this is using publicly accessible data, the researchers' estimated life expectancy at age 45 for black men fell up by 1.4 years in response to the disclosure, accounting for about 35% of the 1980s life expectancy gap between black and white men. Now, that's basically saying that as a direct result of the study being found out, it actually shortened the life expectancy for black men because their distrust in medical staff was at an all-time high. And also, African American men today have the worst health outcomes of all major ethnic, racial, and demographic groups in the United States. So, building on the last slide, in 1997, President Clinton formally apologized for the study and apologized to all those involved. And who we have pictured here is Herman Shaw, and he's one of the survivors. And this is a direct quote from him: "The wounds that were inflicted upon us cannot be undone. I'm saddened today to think of those who did not survive and whose families will forever live with the knowledge that their death and suffering was preventable." Because again, this study really negatively affected the African American community and really heightened their distrust in medical staff. This study did impact society negatively, and it can be said it impacted it positively because of all the new laws and regulations that were put in place, but the suffering of those involved ran deep, and it must not be permitted to happen again in the future. These next two slides are going to be in kind of a timeline, and it's going to be all the new laws, regulations, and guidelines that were passed after the experiment was exposed. In 1974, the National Research Act was passed, and that requires that all researchers get informed consent from any individuals that want to participate in medical research. In 1979, the Belmont Report was published, and this report basically covers all the ethical principles and guidelines that are meant to protect those involved in human research. And in 1981, the HHS and the Food and Drug Administration updated their policies and regulations regarding human research. Continuing on from the last slide, in 1991, the Common Rule, which is also known as the Federal Policy for the Protection of Human Subjects, was published, and the Common Rule was heavily based on the Belmont Report, which we covered in the previous slide. And in 1993 and 1994, the Advisory Committee on Human Radiation Experiments was established by President Bill Clinton. And in 1995, the National Bioethics Advisory Commission was established, and this commission protects human rights of those involved in medical research. And in 1996, HIPAA made the privacy rule, and the privacy rule was intended to protect people's private health information. And in 2004, the Secretary's Advisory Committee on Human Right Protection was established, and this committee was made to give recommendations and advice to the government on issues pertaining to human research. And on this slide, we're going to cover how healthcare professionals can avoid similar issues. Now, every healthcare organization should provide cultural competency training, and it should be ongoing and regular. It shouldn't just be, a one-time thing. And healthcare professionals have to remember that they must leave their personal biases out of the workplace. And if healthcare professionals see something they think is unethical, or if they feel a patient is being treated unethically, they should be able to address the situation in a way that makes them feel comfortable. And one way for them to be able to do this is for a healthcare organization to have a safe and anonymous way for healthcare workers to report any issues that they have. And healthcare professionals should keep up to date on any new laws regarding healthcare. And there are new laws and committees to ensure that patients and those who participate in human research are protected and that their rights are not violated. This is just a summary of everything we went over today. The men in this study were really targeted because of their race, their lack of education levels, and their social economic standing. They were promised free health care. They were enticed with lies, and really they were basically just taken advantage of. Again, the men were not aware they had syphilis. The study spanned 40 years. It resulted in the death of some of the men. Some of the wife contracted syphilis, and some of their children were even born with it. And there was both negative and positive outcomes of the study. One of the negative effects of the study was really the mistrust that was caused in medical staff and in hospitals in the African American community. And when the study was finally brought to light, it caused a reform regarding human research. And as a result of this, there are now laws put in place to protect those involved in human research. And there are also committees that regulate human research. And this concludes my presentation. Thank you for everyone who listened. And this last slide is just my references used for the presentation.